So we are starting our session for today. دكتورة ماجي أهلا وسهلا. So yes, we are starting the session today. Welcome everyone. I hope you are having a great day. دكتور بشرى أهلا وسهلا. Okay, دكتورة منال أهلا وسهلا. Amy, how are you? I hope everyone is doing great. I hope all of you are safe and happy, enjoying the relaxation. I know it's not an easy situation for everyone. However, I think we have to look at the positive aspect. We are relaxing a little bit. The earth is recovering, and we are spending some nice time with the people around us, with our families and so on. البث المرة دي هيكون باللغة الإنجليزية، ولكن يوم السبت إن شاء الله هيكون في بث في نفس الميعاد هيكون باللغة العربية. Today we are going to be discussing any questions you might have in English, but there will be another broadcast on Saturday and on 13th of May as well, which is going to be in Arabic. يوم 13 ويوم السبت هيبقى في 2 بس بالعربي. So I'll be very happy to answer your questions today regarding any laser applications in dermatology. And one of the important topics which we need to discuss today, I have been asked to clarify that a lot, is the paradoxical hair growth. لا الحقيقة انه النهاردة يعني معظم الناس دكاترة ومن دول أجنبية، فأنا بعتهم لأن المرة اللي فاتت كان باللغة العربية، فالمرة دي أنا وعدتهم إن هي هتبقى المرة دي بالإنجليزي، ويوم السبت ثم يوم 13 هيكون باللغة العربية. I was just explaining that this session is going to be in English because some people were asking me to speak in Arabic, but this session today is going to be in English. So the first topic I would talk about is paradoxical hair growth. Paradoxical hair growth is something which can happen if the patients are having any underlying pathology. If the patients are having polycystic ovary or hormonal disturbances, then the incidence of paradoxical hair growth after hair removal with the laser might be higher than if there is no underlying pathology. And that's why one of the first things which we need to ask patients about is the menstrual history. If there is any disturbance in the menstrual cycle, then we have to do investigations, because if there is any underlying pathology, we need medical treatment parallel to the laser treatment. Otherwise, the outcome of the laser treatment is going to be very weak. So this is something we have to be sure that we exclude it and we treat it if it is there. If it is not there, then it's very important to respect the optimizing the laser parameters. So when we start the laser assisted hair reduction, initially the hair is going to be thick in many cases. At that time we use low fluence and long pulse duration to be safe on the skin. However, later on, when the hair is becoming thinner and finer, we have to adapt the parameters to be more effective. So we have to increase the fluence and decrease the pulse duration. If we did not do that, at a certain point, the laser might lead to photobiostimulation. Instead of damaging the hair follicle, it's going to increase the local blood circulation and more hair growth is going to happen. And that's why it's really very important to make sure that we are modifying the parameters as long as the hair is becoming thinner, so that we are effective and at the same time safe. So this is regarding the paradoxical hair growth. Another important thing is that if you are using a laser system, which is not having bulk cooling, which is not like the cold air. When we are using cold air, it is giving bulk cooling during the laser, before the laser, and after the laser. So this is a good way of cooling. However, some systems are going to have contact cooling or cryogen cooling, which is going to be cooling the skin just before the laser pulse. And in this case, the heat is going to spread. So the area which is exposed to the laser pulse is going to be cooled before the laser, but the heat is going to spread to the surrounding area. And this is going to be exposed to what's called photobiostimulation, and hair is starting to grow around. So we try to treat the hair in the chin, and then the hair start to grow in the neck. That's why if your laser system is not having this cold air cooling, then you need to use ice compresses around the area of treatment so that we can cool the whole area, not only the treated area, however, even the surrounding area. This is how we can decrease the incidence of paradoxical hair growth. Okay, so this is regarding the hair paradoxical hair growth. Now, Dr. Maggie is asking about recommendation of laser treatment for rosacea. Rosacea is chronic relapsing condition. We need to, as dermatologists, we need to treat the rosacea with the regular ways, depending on which stage it is. The laser can help in several ways. The pulsed dye laser, which is targeting vessels, can decrease the redness, the erythema, which is associated with the rosacea. The Nd:YAG can be used in order to treat the telangiectasia. But in addition to that, we can use the Nd:YAG as well in the parameters of rejuvenation, where we are using short pulse duration with low fluence, multiple passes in order to stimulate the collagen. Once we are able to stimulate the collagen in patients who are having erythema, this is going to increase the thickness of the dermis, and this will compress the vessels, so the erythema is going to subside gradually. And we have to let the patient know that this is a slow process. So we don't expect that the treatment is going to be quick in effect. We are doing rejuvenation, and by the way, as a side effect, we are going to improve the erythema. We need 3 sessions, at least 1 month apart, and the improvement in the skin is going to occur after the second session and will continue to happen for about 6 months after the sessions. These are the expectations. Of course, we need to use the appropriate topical skincare products and the topical treatment according to what stage we are in. If we have papules and pustules, then maybe oral metronidazole is required and topical metronidazole as well. Otherwise, we have very good skincare products for the rosacea. Dr. Yasser, yes, we are talking in English. And Dr. Lamia, you are welcome. Dr. Khulud. Questions. If you have any questions regarding any application, please, yes. Dr. Yasser, nasal telangiectasia. What is the approach? Nasal telangiectasia is something which I like to treat. If you know how to do it, you're going to do a great job. But if you don't, then it is going to be a big problem. And I have seen so many cases coming with scarring after using the Nd:YAG laser and some other lasers for treating nasal telangiectasia. Nasal telangiectasia or facial telangiectasia, we are dealing with small little vessels. أهلا وسهلا دكتورة سوسن منور. Small vessels. And when we are treating small vessels, then we have to use a small spot size with the Nd:YAG. So 2 or 3 millimeter spot size. Regarding the pulse duration, I would use 10 millisecond pulse duration, and this is fixed if you are treating telangiectasia, whether it is in the face, in the nose, in the leg. 10 millisecond is the right pulse duration. Now, the most critical thing is the fluence. The fluence has to be matching the skin type. If we are treating fair skin type 1 and 2, we have to be conservative with the fluence. I would start with 130, maximum 140 joule per centimeter square. However, if you are using the laser to treat patients with darker skin types like 3 and 4, I would go for 140 or 150. And of course, very good cooling of the skin is very important. with cold air cooling or ice or contact cooling or cryogen or whatever. And usually for treating vessels, I need to use double cooling. So I use the contact cooling or the cryogen or the cold air. Besides, I have an ice cube to cool the skin before and after the lasers. What we expect is that if we are using the right parameters, I expect the telangiectasia, the vein, to vasospasm and disappear without any change at the epidermis. So I don't want to see any blanching or any crust formation or not crust, separation of the epidermis. If this happens, then it means that we are using too aggressive fluents. And this is something which we have to stop immediately with very good cooling of the skin. The Nd:YAG is the ideal because the KTP might do a good job in skin type 1 and 2. Once we treat skin type 3 and above, then there is strong competition between melanin and hemoglobin. So you try to treat vessels, you will affect the pigments as well, and you will get hypo or hyperpigmentation. With the pulsed dye laser, you cannot get enough depth of penetration, and the spot sizes are large, and you will get purpura. And that's why Nd:YAG with small spot size 2 or 3 is the optimal for me. Usually we need 3 sessions, 1 month apart or 3 weeks apart. And we tell the patient that 70% of the veins we are treating will go away within 3 sessions. So these are the expectations. The results are usually very satisfactory for the patients, and in many cases, 1 session will be enough, but usually we prefer to under-promise and over-deliver. So we tell the patients it's 1 to 3 sessions. If they get the improvement and the result in 1 session or 2 sessions, they will be happy. If not, then 3 sessions. This is what we said from the beginning. Dr. Yasser, I hope that answers your question. If anything needs to be more clarified, let me know. Thank you, Dr. Sausan. Dr. Muhammad, the difference between air cooling, cryogen, and contact cooling. I prefer the cold air cooling simply because it is bulk cooling. So it cools the skin before, during, and after the laser. The cryogen cooling or the contact cooling is going to be only parallel, like the diode lasers, or the cryogen will be set to be before or after. So we cannot get the bulk cooling like the cold air. Plus, with the cold air, we don't have a consumable, but also more importantly, there is no interference with the laser tissue interaction. With the cryogen, it's going to be sprayed before the laser pulse, so it will increase the reflection and scattering of the laser beam. If the hair is becoming fine or thin, or the pigmentation is faint, or the vessel is small, when we have more reflection and scattering, it means that we are losing energy. And this means that this is going to decrease the effectiveness of the laser. This is something we are not going to be feeling if the density of the chromophore is high. If we have thick hair or large vessel or dark pigment, there is no problem. But the problem will happen when we have low density of the chromophore, fine hair, faint pigment, small vessels, then there will be a problem. Nd:YAG laser for hair removal. Nd:YAG laser is excellent. It is one of the favorite lasers actually I like because it's a very high safety profile. So it is safe on all skin types up to skin type 6. It is safe even in the summer. It doesn't affect the tanned skin. So it is excellent. In the old versions of the Nd:YAG laser, we were not able to get too short pulse duration, so it was not very effective when the hair is thin or fine. However, today with the newer versions of the Nd:YAG laser, we can use a shorter pulse duration with small spot size, increase the fluence, very good cooling, then it is safe and effective on all skin types and even on the finer hair. Also, we can use the Q-switched Nd:YAG in order to get laser shaving. So at a certain stage when the hair is really fine, then instead of the long pulse Nd:YAG, we can use the Q-switched Nd:YAG in order to shave the hair. It gets bleached first and then it falls off within 7 to 14 days. And then the regrowth is going to happen anything between 1 to 3 months according to the thickness of the hair. The thicker the hair, the longer the remission in between the sessions. So this is regarding the Nd:YAG. Dr. Khulud. She's doing the 4-dimension rejuvenation, little pigmentation disappear. Can we imagine some parameters for melasma? Melasma is excellent. It's really a very important topic because sometimes it's very important to think as dermatologists. We have to realize that once melasma, always melasma. So the best laser treatments, the best hands with the laser, we are not going to be able to cure melasma, unfortunately. What we can do is to suppress the melanogenesis, decrease the color of the pigment for some time, and then it might come back. So in this case, we can use the Q-switched lasers or the picosecond lasers with low intensity to decrease the pigmentation, but we have to let the patient know that it is going to come back. And in order to maintain the improvement, they have to use bleaching agents on and off, sunscreen properly, with maintaining the laser sessions maybe 2 or 3 times per year. These are the expectations. If the patients are happy to go for that, it's fine. If not, then don't play with the laser. We don't really let the patient feel that we are after their money. We have to give them realistic expectations. Regarding the 4D, when we are using the frag-free or the short pulse Nd:YAG, which is called laser genesis or laser facial, where we are using short pulse duration with the Nd:YAG, anything between 0.3 to 0.6 millisecond is considered short pulse Nd:YAG. And because we are using short pulse, it has high peak power, so it will have some mechanical effect and it can shatter some of the pigments. So this is something I'm using with the Nd:YAG. So the pulse duration is 0.3 to 0.6 millisecond. The fluence should be around 15 joule per centimeter square and 5 hertz. And we do painting several times over the face so that we are able to stimulate the collagen. So the skin tone is going to be better. And this will improve the large pores or fine lines and will improve the light reflection. We do 3 sessions 1 month apart. When we do that, it is very important also to work on the epidermis, to improve the epidermis so that any topical agents, bleaching agents or whatever is going to be absorbed much better. And this will enhance the efficacy of the topical bleaching creams we are using or even the skincare products. So this is regarding the melasma. Someone is asking me about the Ulthera. Ulthera is the HIFO, the high intensity focused ultrasound. Actually, I have some reservations about this technology because the pulses of the ultrasound is increasing the skin temperature to 73 degrees Celsius. And with this temperature, we are having coagulation, collagen denaturation. And this causes fibrosis beneath the surface of the skin. And plastic surgeons who operated on patients who had the HIFO or the Ulthera reporting extensive fibrosis below the surface of the skin. And this is going to be reflected in few years on patients who had several sessions of the HIFO with deformity in the skin, where I'm going to see, this is what I expect, we are going to see patients who are walking with acne scars like lesions because of the fibrosis below the surface of the skin. And that's why I don't use it and I don't recommend it to my patients. Maybe if you want and if you have it, do 1 or 2 sessions, don't do more than that. Don't do several lines with different depths because you are going to increase the fibrosis in the skin. I prefer the Nd:YAG and the radiofrequency because they are not causing fibrosis as much as the HIFO is doing. Dr. Mazen, there is a question about periorbital rejuvenation with CO2 laser for skin type 4. The CO2 is good. However, with skin type 4, we have risk of hyperpigmentation. So if you have the CO2 and you have to use it, then it is okay. But please prepare the skin for 2 weeks before the session with a bleaching agent, hydroquinone 2%, with very good sunscreen. And after the healing, also they need to use sunscreen properly and also bleaching agent 2%. This is going to prevent the the post-inflammatory hyperpigmentation, CO2 is effective. However, safety is an issue, and if you are going to use it in the periorbital region and inside the orbital rim, the orbital margin, of course, intraocular shields are required. Otherwise, you can risk of damaging and causing problem to the eye. Ms. Altaf, thank you very much. I also miss being in Kuwait and visiting Kuwait, but inshallah after this is over I'll be happy to come again. شكرا جزيلا. Parameters for eyebrow and lip tattoo. I'm going to talk about general principles. Eyebrow and lip tattoo, those are cosmetic tattoos, and they are formed of inks which are made of several colors and sometimes organic compounds. So when we use the laser for treating those kind of tattoos, we have risk of changing the color or darkening of the color. So before we treat the whole eyebrow or the whole lip, it's very important to perform some test spots, maybe 2 or 3 spots, to see how this ink is going to react. And we evaluate the result after 6 to 8 weeks. We have to give that time in order to have the full result. Otherwise, we can get temporary improvement and then the color will change. So it's very important to perform first few test spots and then evaluate it after 6 to 8 weeks. The principles regarding the parameters is that the dark color, the black, the brown, the green, we need the 1064, the Nd:YAG. The red and the orange and the yellow need the 532 wavelengths. And the fluence, we have to use low fluence when the tattoo is dark and fresh, and we increase the fluence accordingly when the tattoo is fading, when the tattoo is becoming lighter. So this is the principles, and we have to have the endpoint, so grayish or white coloration with the laser pulse. Karina, you are welcome. A question about Alexandrite laser. How can we assure that we choose the right parameters after hair removal laser? In order to judge the right parameters, I like to have a little bit of the hair on the surface of the skin. So I don't like to shave completely before the laser session, because I need to see the laser tissue interaction. If I'm using the right parameters, there will be some sort of burning of the hair, which should be very short, because if it's long, it's going to burn the skin. And then also we get some perifollicular edema. But for me, the reaction of the hair to the laser pulse is enough, and I need to see some sparkling and some charring of the laser of the hair shaft, and this is going to be a good indication that I'm using the right parameters. I hope that answers your question, Hermine. If not, please let me know. Dr. Yasser, if you didn't get the vasospasm, if the vein did not disappear, then at least it has to become darker. So intravascular thrombosis. If nothing happens, if it was not darker, and if it did not disappear, then we do another pulse with very good cooling in between, of course. If the second pulse didn't do anything, then you can increase the fluence gradually. So this is how we do. We try the pulse with the parameters we think it's going to work. If it didn't work, I do a second pulse. If nothing happens, then I increase the fluence. If I'm using 140, I use 145 or 150, and then I evaluate again, and so on. Yes, Dr. Hazem, regarding shaving before hair removal, is it recommended? It depends on your system. If you are using a diode system or a system with sapphire window, you cannot have any shaft on the surface of the skin. Otherwise, this is going to be burned and it will damage the lens and it can cause burning in the skin. However, if you are using a non-contact laser, like the diode, like the Alexandrite or the Nd:YAG, then I would recommend trimming, just trimming with electrical trimmer, so that the hair shaft is short, less than 1 millimeter, so that you are able to see the reaction of the hair to the laser pulse and evaluate if the parameters are effective or it is not effective and you need to modify the parameters. On the other hand, also, one of the benefits of seeing the hair is that you can see where you treated and where you did not treat, so that you avoid too much overlap or skipping areas. And that's why I prefer to see what I am treating. This will enable you also to select the right parameters for the thickness of the hair and the density of the hair. دكتور لاميا لبيب أهلا وسهلا. Bromohydrosis. Yes, we talked in the last session about bromohydrosis. Many people who are having hair removal in the axilla, in the underarms, they complain of bad smell of the sweat afterwards, and this is a condition called bromohydrosis. It is not a very common side effect, but of course with the spread of the hair removal sessions we started to hear about it. Usually it's temporary, and in many cases it's going to subside after a few months, but we can improve it with injecting Botox if it is annoying the patient. Dr. Alami, I hope this answers your question. If not, let me know. Dr. Omneya, hyperhidrosis, many patients. Yeah, I think I answered that question. We don't know. No one knows why it happens, but it has been an observation, and we don't know why it happens and how long it stays exactly. This is something no one was able to find out the exact reason for that. Blue veins around the eye. Is it safe to be used with the long pulse Nd:YAG? I have a publication, a paper. If you Google, it is an open source. So if you write periocular veins and my name Ashraf Badawi, it is going to be found. It's a full paper and it's open source. However, I'm using, yes, the Nd:YAG laser for treating veins around the eye. There are some precautions in order to avoid scarring or damaging. Number one, it is very important to use very good cooling. Cooling of the cold air or the contact cooling or whatever, plus also ice compression with ice cubes or whatever ice compression. This is very important. The other thing is that we have to use a small spot size, 5 or 6 millimeter spot, 30 millisecond and 130 joule per centimeter square, not more than that. And then the handpiece has to be directed towards the bone, not towards the eye. So if I have a vein around the eye, then I put the handpiece on the bone downwards, not upwards. The handpiece should never be directed towards the eye. It has to be directed toward the bone. And I have to pull the skin a little bit outwards, downwards, so that I'm outside the orbital margin. And of course, the patient has to be wearing the goggles. So those are very important precautions to avoid, to keep in mind. And we have to let the patient know that bruises might happen, and if it happens, it stays for 7 to 10 days. Dr. Rami is asking about systemic lupus without any active skin lesions. Can we do peeling with fractional laser? We can do peeling. It's not a problem. However, it's very important to know that if the patient is taking certain medications like corticosteroids or antimalarials, then the incidence of hyperpigmentation with the antimalarials or with the poor healing or slow healing with the corticosteroids might happen. So this is something which can be considered, and systemic lupus actually and lupus vulgaris has been treated by the pulsed dye laser. So it is not a contraindication for laser. I hope that answers the question, Dr. Rami. Becker nevus, Dr. Yasser, again a very good question. Becker's nevus is a compound nevus, so it's partially in the epidermis and partially in the dermis, and usually it is taking large part of the skin. So the outcome is not always very favorable. Sometimes we are going to get some improvement in certain areas of the lesion, and some areas will not respond or even get darker. So it is a challenging condition, and I try to convince my patients not to treat it. If it is hairy Becker's nevus, we do hair removal, and sometimes it's going to be lightened, and the patient will be satisfied, and we don't need to do anything more. If the patient insists to get treated, then I do by segments. So I work on about 10 centimeters square of the lesion with a Q-switched Nd:YAG and Q-switched KTP in the same session. So we use the Q-switched Nd:YAG for dermal pigmentation, followed by Q-switched KTP 532 for epidermal pigmentation in the same session. And then after 6 weeks, we repeat again the session on the same area. And we keep doing the sessions on the same area till we get rid of, or at least get the best improvement. And then we tell the patient this is the maximum we can achieve. If the patient is satisfied, then we can go for another segment of the lesion and so on. But I don't treat the whole lesion. If you treat the whole lesion, you are going to charge the patient a lot. And usually when the patient's paying a lot, the expectations are very high. So don't do that, and work on segments if the patient insists. I personally try to tell the patient it's benign lesion, no need to treat, and it's never going to turn into malignant. أهلا وسهلا. You are all welcome. I'm very happy to see all of you. The best laser treatment for hyperpigmentation, pigmented congenital nevi. Usually the Q-switched lasers are going to be the best. However, in sometimes we need to combine between the ablative lasers like Erbium-YAG or CO2 and Q-switched lasers in the same session. So when we do the combination of those treatments, this is going to give the best results. Of course, it's very important as dermatologists to examine those congenital nevi and exclude that it is not 100% benign. If there is any suspicion about the nevus, we don't touch it with laser. This is for excision and biopsy. If there are any recent changes in the nevus, if there is irregular border, if there is bleeding, if there is pain or loss of hair, then it is going to be a problem. We should never touch it with laser, and this is something for excision and biopsy. There is a question, حفر في البشرة ومسام في so white pores and some scars, acne scars. This is a condition where we need to improve all the layers of the skin. We need to improve the epidermis so that we have better epidermal barrier function, and this is something we can achieve with chemical peels, with prescription of retinols, with microdermabrasion, which I really like, with superficial peeling with the Erbium-YAG. This is to target the epidermis and improve the epidermal barrier function. When we improve the epidermal barrier function, the skin is going to be able to hold in the water, not lose the water by vaporization, and this will improve the skin elasticity, so the skin is becoming smoother, and this will decrease the pore size. Then also we need to stimulate the collagen synthesis, because we start to lose collagen from the age of 20. Every year we lose 1 to 2% of the collagen. So by the age of 40, we have lost something like 20 to 40% of the collagen. And that's why we need to rebuild and renew the collagen. And this is something we can do with microneedling, with the derma roller or the derma pen or the microneedling radiofrequency devices, or the fractional lasers or the Nd:YAG laser. Those procedures are going to stimulate the collagen and improve the pores and improve the texture of the skin. Also, if there is skin laxity, then we need to tighten the skin, because if we stretch the skin, the pores are going to be better and the lines and the scars will be improving. So if we stretch the skin and the scars improve, then it means that there is a skin laxity, and tightening will help. So in this case, it is not one single procedure. We need to build a treatment plan in order to improve all the layers of the skin. This is how we can improve the pores and the scars. أنا بتكلم في الجلسة دي باللغة الإنجليزية، لأن في زملاء من خارج البلاد العربية طلبوا مني كده. إنما إن شاء الله يوم السبت وبعدين يوم 13 هكون في برودكاست وأعلنت عنها أو هعلن عنها على الصفحة بتاعتي إن شاء الله. هي هتكون على صفحات بعض الزملاء، الدكتورة نور التجلي يوم 13 والدكتور لؤي صلاح من السعودية يوم السبت القادم بإذن الله. فعذرا إن أنا النهاردة بتكلم باللغة الإنجليزية. دكتور خلود، melasma patients. Yeah, melasma patients. If you want my advice, I don't start with laser treatment for melasma. For melasma, I would use sunscreen, bleaching agent, microdermabrasion. Microdermabrasion is a mechanical peeling of the skin with no downtime. It's very gentle procedure. We do 4 sessions, 1 week apart, and then every 3 months a session. This is to maintain good epidermal barrier function. And this is going to enhance the absorption of the bleaching agent. Plus sunscreen, we need to use sunscreen. The proper use of sunscreen is SPF above 30. It has to be used every 2 to 3 hours as long as we are exposed to the sunlight or the daylight lamps. Yani even if we are indoors, we have to use the sunscreens if we are staying in daylight lamps. When we do that, this is going to suppress the melanin production and will induce remission of melasma. If it was refractory and it did not respond, then we can use, of course, the tranexamic acid, and we can use the fractory or the low intensity Q-switched Nd:YAG laser. I don't prefer the 532 because sometimes it can cause more pigmentation. Thank you, Bushehri Clinic. I miss Kuwait and Bushehri Clinic very much. Hopefully this is going to be over soon. Thank you. Okay. Dr. Omneya, hyperhidrosis after laser hair removal in the underarms. I think the best solution is to inject Botox. This is the only thing I can imagine, because sometimes we get, refractory hyperhidrosis or bromohidrosis after the laser hair removal. And this is something actually interesting. I always believe that going away from the physiology will create disorder. When people used to have more physical exercise and efforts before having cars, they had much better health. When we started to ride cars and have less physical activities, we started to have more heart diseases. So sometimes we have to use the technology, but we have to expect some disorders because we are going away from the physiology and how God created us. So hair removal is a good option to have, definitely, but sometimes we will have unexpected side effects. One of them is to have hyperhidrosis or bromohidrosis, and if that happens, then fixing that with some Botox, which is going to be temporary, improving the situation, might be the only solution. Yes, Dr. Abdul Ati, which is better for laser hair removal, IPL or laser? Actually, if the hair is thick, IPL is going to do a good job. However, if the hair is deep, then the IPL will not give you good result as the laser, because the IPL is non-collimated light. So it cannot penetrate deep enough. So it is going to be giving you temporary good result because the shaft of the hair is going to be affected, but then the recurrence and the regrowth of the hair is going to be with higher percentage than with the laser. When the hair is fine, the IPL is polychromatic, so the shaft is going to absorb the laser. If the hair is superficial, the IPL will do a good job. If the hair is deep, then definitely the laser is going to be much better. Now, having said that, it depends also on the laser type, because if you are using diode laser, with the diode we cannot control each parameter separately, independently. So with the diode laser, if we are having thick hair, it is going to be doing a fantastic job. Safe, effective, very nice. However, when the hair is becoming thinner and finer, we need to use shorter pulse duration and higher fluence. This is not possible with the diode. With the diode, if you reduce the pulse duration, the fluence will go down automatically. You cannot control each parameter independently. And when that happens, it is not going to be very good. That's why the diode is not effective in fine hair. So if you compare the diode and the IPL in fine hair, I would tell you that the IPL would be a little bit better. I hope Dr. Abdul Ati, this answers your question. دكتور إيمان أهلا وسهلا منورة. Q-switched long pulse Nd:YAG is effective in rejuvenation. If we have dyschromia, if we have photo damage, so there is some pigmentation, then the Q-switched Nd:YAG with low fluence 2.5 or 3 will do a good job. However, if we don't have pigmentation, if you have large pores, fine lines and wrinkles, then the long pulse Nd:YAG with short pulse duration 0.3 to 0.6 milliseconds is going to be much better because the thermal effect is going to be better, so it's going to stimulate more collagen than the Q-switched Nd:YAG, which is having mechanical effect rather than thermal effect. The thermal effect with the longer pulse duration is going to be doing a much better job in stimulating the collagen and improving the pores and the texture of the skin. So دكتور منير أهلا وسهلا بك وعليكم السلام ورحمة الله والله أكرم. Rule for the laser in treating skin cancer. Actually, there are many reports and studies about using the laser to treat BCC, basal cell carcinoma, because it's locally malignant. But any other type of laser is not of cancer is not recommended because of the spread. With the basal cell carcinoma, laser can be used. However, if I have the choice and depending on the site, maybe excision is the best and the safest because you know what you are doing. Histologically, you can examine the edges of the excised tissue and make sure that it is free. With the laser, we can do it, but you will never be able to confirm that you removed all the cancer cells. So you might need to do it several times. Congenital hyperpigmented nevi with laser, this is I answered, so it's going to be in the recording which is going to be posted. We have to just make sure that it is completely safe. If we have any suspicion, we don't do it with the laser, otherwise with Q-switched laser besides the ablative laser. مدام كفاية أهلا وسهلا منورة. دكتور حسين منور أهلا وسهلا وعليكم السلام. Periocular and periorbital hyperpigmentation. Perioral and periocular. Periocular hyperpigmentation, dark circles around the eye, الهالات السوداء. This is a very challenging situation. We have to diagnose the cause. We have to know what is the cause. Sometimes we get impression of dark circles around the eye if the skin is lax. If we have lax in the skin, like me, then the reflection of light is not very good. So if we stretch the skin, there is no pigmentation. So in this case, tightening the skin and working with something to tighten and stimulate the collagen in the area of around the eye, periocular area, it's going to improve this light reflection issue, and the dark circles will improve. Sometimes also, if we stretch the skin, we are going to see some vessels, and those vessels will give impression of dark circles around the eye. And if this is the case, using the Nd:YAG laser to get rid of the vessels will improve the situation. Now, if the cause of the pigmentation is real pigmentation because of genetic reasons, this is the most difficult, and we have to know our limits. In many cases, we cannot improve that much. However, some PRP injection and improving the texture of the skin can improve the situation, but there is no permanent solution for this. For perioral pigmentation, sometimes it happens due post-inflammatory hyperpigmentation, atopic patients who are having atopy and skin sensitivity and dermatitis. This might happen. One of the things which is important to mention to the patient that we have to avoid toothpaste which is containing fluoride, because fluoride can cause hyperpigmentation. So this is something to be avoided. I don't recommend using the laser because sometimes it can increase the pigmentation. especially the Q-switched lasers. What we can do for the lips is using the rejuvenation of the lips with the Nd:YAG, because when we increase the volume of the lip, then again the light reflection is going to be better, so it's going to be in a much better situation. So the best for the dermal pigmentation in the face للتصبغات العميقة, if the tranexamic acid orally or topical is better, of course the oral is going to be better. Sometimes we do combination of oral and topical, فبنستخدم الاثنين في نفس الوقت, but we have to make sure that the epidermal barrier function is good, because if you apply anything topically while we have hyperkeratosis, it's going to be not effective. So we have to make sure that we have epidermal good epidermal barrier function, so that we ensure proper absorption of whatever we apply on the skin. And the treatment has to be for a long time, for 6 months. We don't expect dermal pigmentation to improve before continuous treatment for 3 months at least. So the patient has to be patient. Dr. Yasser, you are more than welcome. Dr. Mu'tasim, أهلا وسهلا. Laser hair removal can increase in the white hair. Dr. Mu'tasim, this is an excellent question. White hair after hair removal with the laser. There are 2 scenarios. The first scenario is someone who is having some white hair among a lot of black hair. So in many cases, the white hair is not going to be visible by the patient. And then we start the laser assist hair removal. The laser will get rid of the black hair, but it will not affect the white hair. So the white hair is coming, the patient will come back complaining that I developed white hair. They didn't realize that they had white hair before because it was covered and masked by black hair. When we get rid of the black hair, the white hair is going to be more apparent. So we have to examine the patient well and tell them you have white hair if they do, and we write that in the file and take photos and tell them that the white hair will not be affected, and the only solution for white hair till now is the electrolysis. There is no better solution than that. Now, the second scenario, can the laser induce white hair? Yes. If someone is in the late 40s or the early 50s and they have black hair, yet it is black, and we used conservative fluents, we are using the Nd:YAG, for example, and instead of using 30 joule per centimeter square, I'm using only 20 because I don't want to affect and harm the skin. Or I'm using too long pulse duration, again to be safe. In this case, if the fluence is too low or the pulse duration is too long, then it can damage the melanin of the hair follicle. The follicular melanin will be damaged, but without enough heat to damage the hair follicle itself. So we can turn a black hair into a white hair with the laser if we use conservative fluents. And that's why if we have a patient who is in the susceptible age group, we should not use conservative parameters. We should use the right fluents, the right pulse duration, and protecting the skin by using appropriate cooling, not by using conservative fluents. So this is the story about the white hair. And again, the white hair only solution is electrolysis. Nothing else worked. Dr. Hazem, to avoid whitening of the hair, my recommendation, I just mentioned, I answered that question regarding the white hair. Dr. Hazem, speckled nevus treatment with Q-switched Nd:YAG and or KTP 532. Actually, I prefer in this condition to use both. I use 1064 first, followed by 532, because in many cases the pigmentation is compound, partially in the dermis and partially in the epidermis. So in order to tackle both the layers, I would use 1064 first because we want to target the deeper layer first, followed by the 532 in the same session. Hello Marjan, how are you? Taqshir, what about the peeling, chemical peeling? Chemical peeling is good, in good hands. but we have to understand or know how to prepare the skin before the peeling and how to take care of the skin afterwards. I personally prefer the microdermabrasion and the similar technologies like the hydrofacial, like the silk peel, like the mesojet, like the all those technologies, because these are associated with no downtime, no risk of hyperpigmentation like the chemical peels. We usually with those procedures, we are not only improving the quality of the epidermis, but also we are improving the microcirculation and the lymphatic drainage. So that's why I prefer the mechanical peeling rather than the chemical peeling. The best laser for facial hemangioma on the cheek, type 3 skin, I think the Nd:YAG is going to be the best. But the incidence of scarring and texture changes is high, so we have to be gentle with the parameters. If the hemangioma is thick, we need to compress it with the glass slide so that we are bringing the walls closer to each other, and then we use the Nd:YAG, the long pulse Nd:YAG, in order to treat the hemangioma. If the hemangioma is superficial and small, then the pulse dye laser would be a much better and much safer option to be treated. Dr. Pablo Buxida from Madrid, I hope everything is okay. Thank you for joining, and I hope you are safe and the situation is becoming under control in Spain. Dr. Yasser, indoor lamps emit ultraviolet. Yes, fluorescent lamps, daylight lamps are emitting ultraviolet, and many cases come with hyperpigmentation after the laser treatment because they stayed in that daylight fluorescent neon lamps for a long time without sun protection. So any patient who is exposed to daylight lamps should be using sun protection every 2 to 3 hours. What about IPL for what application? Skin laser aesthetics, please let us know. IPL for hyperpigmentation, if it is epidermal hyperpigmentation, IPL does a good job. However, if the pigmentation is dermal, the IPL has no role at all. So because it cannot go to the derms. Dr. Hazem, what about Miradry for hyperhidrosis? The microwave technology, I think it's good. We don't have long-term results. However, I think it's very painful. This is the complaint which I'm receiving. How long is it going to be effective? I don't know. I don't have experience with it, but I think it damages the sweat glands. But I don't know how durable the effect after the Miradry is. After pico laser for tattoo removal, if there is improvement after if there is no improvement after the first session, what should be changed? We should increase the fluence. Sometimes with the pico systems, we have limitation with the fluence. And also one of the other important things is the location. Because if the tattoos are present in body areas with poor lymphatic drainage, the outcome is going to be poor. And in this case, I recommend to combine the Q-switched or the picosecond laser with fractional ablative or fractional pico or fractional Q-switched laser, because then we are going to be opening channels on the skin to slough the pigments. This would be the best. Of course, we have to see color change. So when the tattoo is dark, low fluence will do a good job and we are going to see the whitening. If the tattoo is faint, then we have to increase the fluence in order to see the color change and the immediate whitening. Dr. Maisana, I hope this answers your question. If not, then let me know. Fine hair removal with the Nd:YAG or Q-switched Nd:YAG. If the hair is having good amount of melanin, then the long pulse Nd:YAG with short pulse duration, 10 milliseconds or even sometimes 5 milliseconds, would do a fantastic job, but small spot size and increase the fluence and very good cooling. If the hair is much thinner, then the Q-switched Nd:YAG would be the ideal, but we have to let the patient know that we don't expect reduction. we get rid of the hair for 1 to 3 months, and then it will come back. So we have to be very transparent and very frank with the patients, give them realistic expectations. So the Q-switched lasers will not lead to hair reduction as the long pulse laser, but it is safe and will get rid of the hair for 1 to 3 months. Local treatment for benign the laser acid and topics. Dr. Khulud, I don't understand the question. Please explain. Dr. Sausan, the home use lasers versus the professional lasers. Excellent question. The home use lasers are having low power, and the studies showed that we don't get reduction more than 40 to 43% after 6 sessions, after the required number of sessions, and the energy is low. So in the hair, if the hair is in the face, there is a risk of paradoxical hair growth. The studies showed that having the home use lasers might encourage people to go to the clinics, not the opposite. In Canada and in the States, many clinics are selling those home use laser hair removal devices to the patients for retouch in between the sessions. So it is something so that they come to the clinic every 3 months, every 4 months, and in between for the retouch, they use the home use device. And patients realize what good job we are doing, because the machines are very slow and it's not as effective as the professional devices. So they appreciate what we are doing, but for maintenance, not maintenance, just for retouch, they can have those home use devices for the in between the sessions. I don't recommend it for the face and neck because of the risk of paradoxical hair growth. I hope this answers your question, Dr. Sausan. Shayma, yes, inshallah, I'm going to save the video after so that it's going to be available, but at least it's going to be for the live for 24 hours, but I'll try to save it so it's going to be there for longer. Post-inflammatory erythema, how can we treat it with the Nd:YAG? The post-inflammatory erythema, we can use the Nd:YAG with the short pulse duration, just like the 0.3 to 0.6 millisecond and 15 joule per centimeter square, and do painting. We keep painting till we reach a temperature of 42 degrees Celsius for the skin and maintain the pulses for 3 minutes. After reaching that temperature, this is going to stimulate the collagen synthesis and improve the quality of the skin, will compress the vessels, so it can improve the erythema. Thank you, Dr. Lamia, to offer the smooth eye for me. I really appreciate it. Thank you. What about fine wrinkles around the eye with fractional CO2? I think I answered that question. We can do that, but we have to take all the precautions to avoid damaging the eye with the intraocular shields, with preparing the skin before and after, and taking care of the skin after, so that we don't get hyperpigmentation. But CO2 is a good option, of course, especially in fair skin. In dark skin, we have risk of hyperpigmentation, so we have to avoid that. Dr. Riham Labib, أهلا وسهلا بيكي. Dr. Munir, acanthosis nigricans and laser. I think this is a condition where laser is not going to help a lot. We need to ask the patient to reduce the weight. If there is diabetes, it has to be treated with some keratolytic agents. The situation can improve. If you do resurfacing, you can actually increase the hyperkeratosis, so I don't recommend it at all. Thank you, Dr. Riham. أهلا وسهلا مدام هالة، نورتي وشرفتي. Dr. معتصم العفو, you're more than welcome. Thank you, Dr. Omneya. Thank you, Dr. Pablo. Oxygeneo, this is not laser, Dr. Lamia. You know it better than me. However, it is a very good system for improving the epidermal barrier function. It's one of the fantastic machines. I really love it. Facial lupus erythematosus with PDL, yes, it can work. Pulsed dye laser also is another option, and NDAG is another option. I prefer the NDAG because it's infrared, it's not visible, so those patients are having some sort of photosensitivity in many cases, so I would prefer the NDAG over